So we're doing a short treatment on Carly here. She's got a repetitive stress type running injury, which kind of comes down through here, which basically causes stress and pain down her leg while she runs. So some of that's going to be tightness up through the Achilles tendon and down through this tendon and into here. What we're going to use is the Multi-Radiance TerraQuant Solo to stimulate healing in that area. So essentially what we're doing is we're using laser to stimulate some of those cells to produce more ATP, to produce more energy, to help that area heal. We're also going to try to relax some of the muscles that are surrounding that area. And laser also gets more blood flow and, as I mentioned, just basically stimulates healing in that area. And the TerraQuant is able to penetrate pretty deep into that area, and it's pretty easy to use. You just basically activate it, and you get to choose programs. We're going to use the 5 Hertz program, which is a little bit more for chronic type injuries. And you put it right up on the skin, and your number of treatments is basically going to vary depending on how chronic an injury is, but you can actually use laser therapy up to twice a day on any specific area. After that, there's a point where your body basically stops accepting that energy, where it's not necessarily counterproductive, but there's really no benefits in using the laser. And you can actually push in a little bit, and the body is able to absorb a little bit more of that energy. So laser can be done from farther apart, but if you think about it, more of that energy is getting absorbed into the atmosphere versus into the body. So we want to get as much of that laser energy, which is called joules of energy, into the body. And this is our first actual treatment, so other times we may experiment with a little bit of movement, having Carly move through. We can do sort of a little bit of stretching, sort of soft tissue work in that process. But the nice thing about the TerraQuant Solo laser is it's basically made for anybody to use. It's FDA cleared for over-the-counter use, meaning anybody can use it without a prescription. And it has a number of programs built into it. So whether it's a chronic injury or a more acute injury, which is something that just occurred. So if Carly went out and just sprained her ankle, we'd be using a little bit different program. And it's really simple. Each program just runs for about 5 minutes. And there's a 900 nanometer laser, which is super pulsed. It's able to provide really quick bursts of energy into the tendon and the soft tissue where the injury is. Also, there's if you notice some of the red lights, those are diodes, light emitting diodes or LEDs, which are in the 600 wavelength and work on some of the more surface tissues. So we're kind of able to get the real deep areas of the body, or specifically on the injury, as well as the more superficial layers where there may be a little bit of trauma. And it's real simple. You just kind of moved around that specific area. And is that sore at all as we move it?
Down towards my ankle.
Yeah. And when you're running, where do you specifically feel a lot of pain? Does it kind of come across this top?
From the back of my ankle, it shoots up on the side of my leg.
Up this way?
Yep, and then it also shoots down into the arch of my foot.
Mm-hmm. And the other tip that I would say for people that are using laser therapy is to basically sort of think about the injury and where it might be coming from. So a lot of times you might feel pain in a really specific area, but some of it may emanate from an injury somewhere else. So you're actually going to think about the injury and try to treat not just the exact pain point, but where you think it may come from. Laser can even be used in some cases if this was a cast and we're trying to speed up healing of a bone. You can actually get into the arteries, and some of the light and energy gets into the bloodstream and delivers some of the energy specifically to the area where the injury is. So you don't always have to specifically work where the pain is. So you just kind of move it around. And Carly's a big runner, so usually that Achilles tendon and those deeper soleus gastroc muscles are often real tight. So you're probably going to want to get up into that area too and provide some energy. And one thing I would say is if you can just sort of relax a little bit and just, yeah. So if you're tight, it's going to be a little bit harder to treat that area. And each program runs for about 5 minutes. And chronic injuries, they're a little bit different than treating something that's more acute. If this was an acute twist or sprain, laser has an amazingly quick effect. A couple of treatments, you can usually heal things pretty well. If it's a little more chronic, then your treatments are probably going to vary, and it's usually anywhere from 3 to 20 treatments. So the nice thing about the Teraquant is that you can use it at home any time of day. It's very portable, it's battery operated, and really the simplicity of it. And that's it. We if it's really bothering her and it's something that's pretty chronic, I would probably do it up to 2 times a day, sometime in the morning, sometime in the evening. And I might even vary some of the programs so that your body gets some different types of frequencies or stimulation, which is basically your pulse rate, a little bit of variable pulse rate into the body. And I think anecdotally, sometimes the body absorbs those variable frequencies a little bit better. So, and we can show some other injuries and other injury treatments at another time.